Aspire Healthcare is a medical technology company, and we're particularly interested and specialise in what are called biofunctional textiles. These are fabrics which have a biological or a therapeutic action, and one of our areas of great interest is a specially prepared form of silk fabric which has been designed to help in the management and treatment of eczema. DermaSilk is a form of therapeutic clothing which has been designed to be used in the treatment of eczema. It is unique, in fact, in that it is the only therapeutic clothing certainly available in the UK which is supported by a considerable amount of product-specific clinical evidence. That's to say, when we were developing DermaSilk, we submitted it to a number of clinical trials in patients to see whether it worked or not. And the results of these trials demonstrated conclusively that it is, for instance, more effective in controlling the itch and inflammation of eczema than cotton, which is a very commonly used base clothing by patients with eczema. So it represents an innovation and an advance in the management of eczema. Cotton was always the traditional advice that doctors would give to patients with eczema. This is the best material to wear next to your skin. Why did they give that advice? Well, there was certainly no evidence to support it, but it just seemed logical because cotton was plentiful, reasonably cheap, and of course is nice and smooth. But in fact, we now know that if you look at cotton under the microscope, although it feels nice and smooth, it actually consists of a lot of quite short, very short fibres, and particularly when they get rather damp through sweating and so on, they can act as a sort of abrasive pad almost, which rubs on the skin and can actually impair and interfere with the skin and make it worse for the patient who's got eczema. Now, an ideal alternative is silk, which of course used to be extremely rare, very expensive, and has always been associated with that end of the market, but is now much more plentiful. And indeed the silk I'm talking about anyway is a specially prepared medicated form of silk. But the key thing about silk is that it's a single long fibre, so it's very low friction and doesn't rub against the skin. It also has the ability to wick away moisture, so it deals very well with sweat and so on. And as a result, when made up into a material to be worn next to the skin, is ideal for patients who suffer from eczema.
DermaSilk has changed our lives in many ways, more so for Dominic in terms of providing him greater comfort of an evening. DermaSilk helps to regulate his temperature either in the winter or in the summer, which is more beneficial to him. And then of course for us it changes our lives because whilst he's comfortable, we can relax and be comfortable too. Before DermaSilk, Dominic's sleeping patterns could be very erratic and very disturbed. He'd wake up frequently itching or being too hot, or his eczema was bleeding because he was scratching it too much. With the DermaSilk, they help to eradicate some of those symptoms, so therefore his sleeping became a lot easier and he was able to sleep better throughout the night.
DermaSilk clothing to me feels soft, stretchy and really, really comfortable. Helps me to sleep better at night because it stops me from scratching and keeps me cool at night.
We had a lovely holiday in Spain this year. It was very hot, as you can imagine. The weather was fantastic, and it was helped even more so with the DermaSilk pyjamas for Dominic, which he wore of an evening to help keep him cool and comfortable. What did you think of your holiday, Dominic?
I thought it was quite nice, and the DermaSilk pyjamas helped.
We use DermaSilk in our dermatology clinics because we found it's had a good effect on maintaining the children's skin. When they've had quite severe and chronic eczema and we've managed to gain control of it, we've had problems keeping it in a good phase. But by introducing the DermaSilk suits into their care regime, it's helped to keep it in a good phase for longer because it's keeping them cooler and less itchy. The DermaSilk garments are easy to use because there's no complications in the application of them. They're just literally worn as pyjamas. Some of our children also wear them underneath their school clothing if they find their school clothes irritate or they get hot at school. With the DermaSilk, they just get up, they wash, they moisturise. Generally they have their breakfast while their cream absorbs, and then they stick their DermaSilk garments on, get dressed and off to school, and vice versa at bedtime. They have the bath, apply their emollients, let it absorb in, and they're just worn as pyjamas. So it's a lot easier than using the double layer wet wrapping technique, or the dry wrapping, which some people seem to use as well. With the DermaSilk garments, we generally apply a light application of the emollient because we want it to be absorbed and we don't want the skin to be sticky. So we probably use about 50 to 100 grams of emollient if it's going to be worn all over. With the double layer wet wrapping, we need to be applying liberal amounts of emollient, so we might be using 200, 300 grams, if not more, if it's being used in the garments themselves. So cost-wise, we do reduce the amount of emollients that need to be used.
At the dermatology conference that we attended, the DermaSilk products that we came across, we hadn't actually heard much about, so the clinical data was really important. We went away, we read the data, we spoke to the people at the conference, but then we actually tried the products. We spoke to other colleagues and they've tried the product and they'd had great success. And it was really important because we needed to know the background and we needed to have the information underpinned. But the actual product itself, with the parents' point of view, that's when we found, that it was really useful.
For DermaSilk garments, when we request them from the GP, we usually ask for 2 to 3 garments at a time. One reason for this is the cost of them, and it can be quite scary for a GP to see that initial cost. But long term, they work out quite cost effective because they last anything from 6 to 12 months or until the child grows out of them. If you compare them to the cotton suits, where we generally use them double, for the wet wrapping, we need at least 6 to 8 sets of garments, that's the vests and the leggings, and they will only last 20 to 30 days. So cost-wise, they do sort of balance each other out, and in fact, long-term, the DermaSilk do work out more cost-effective because it does gradually improve the child's skin condition, therefore reducing the amount of emollients and topical steroids used as well.
The benefits now, after using the DermaSilk for approximately 2 years, far outweigh the costs in terms of prescriptions and visits to our GP.
I would recommend the DermaSilk product to other peers and colleagues. Just with the experience of the children that we treat, it's made their life more comfortable, even at school time and even sports. My own son wears DermaSilk under his ice hockey equipment, and it prevents them getting hot and overheated as well. At school, nurseries and everything, it's made a lot of difference to a lot of children. Sleep time, parents are that pleased that the children are actually sleeping of a night time, not waking up, scratching and itching, and they're not having to get up in the night and cream the children every hour. And we found that the product has just made a lot of difference to the children's lives and their families.
Eczema, of course, is a chronic, long-term disease which flares and has remissions, and there's no one quick fix. We all know that. And so inevitably the patient with eczema will require constant management and be on a sort of therapeutic merry-go-round of emollients, topical steroids, antibiotics and so on, sometimes hospital referral. There are good times and bad times. And I suppose the question is, well, where does DermaSilk fit into this? And that's a really important aspect, because DermaSilk is very much a regular daily prophylactic form of treatment. In addition, it's an adjunct to, of course, the therapeutic merry-go-round. But the point about it is that if you can get your patient controlled through your emollients and topical steroids and so on, then the regular daily use of DermaSilk has been shown to maintain that remission and potentially will cut down on further need for topical steroids, potentially will cut down on the need for secondary referral. And so it's very much a part of the management that really should be thought about in the initial stages of the disease, particularly in the very young child who may present at the age of 3 months and be looking at a number of years of discomfort. The use of DermaSilk will undoubtedly benefit that child and help in maintaining a nice level line of treatment and a level line of disease without too many humps and hillocks and flares and remissions, and hopefully without, of course, the expense of secondary referral. So we think the whole area of therapeutic clothing, of these biofunctional fabrics, is extremely interesting. It's a new science, it's only just beginning to dawn, really. And so we're going to continue to explore this whole area. In fact, at the moment, we're involved in clinical trials on using DermaSilk material of pants made out of DermaSilk material in the maintenance and control of recurrent vulvovaginitis and also of lichen sclerosis of the vulva. So the area of wound care as well opens up a number of opportunities, and we're currently developing products in terms of wound care and also control of lymphedema using this silk-based material. One of the great things, of course, about biofunctional fabrics is that they're a therapy, but they're a therapy with no safety issue. And that's a very unusual thing to be able to say. Most normal therapies, as you know, will have a downside. There will be side effects, there have to be, but not with therapeutic fabrics. So it's a nice, safe area to work in, and it's also extremely satisfying given the results we've got so far.